Welcome to Idea Sessions. In this video, we will cover what is the cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is a widely recognized and evidence-based form of psychotherapy that emphasizes the relationship between thoughts, feelings, and behaviors. Originating in the 1960s, CBT was developed by Dr. Aaron T. Beck as a structured and goal-oriented approach to treating mental health conditions. Since then, it has evolved and been extensively researched, proving effective for a variety of psychological disorders and issues, including depression, anxiety, post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, OCD, eating disorders, and even insomnia. At its core, CBT is grounded in the idea that maladaptive or distorted thinking patterns contribute significantly to emotional distress and unhelpful behaviors. By addressing and modifying these negative thought patterns, individuals can learn to respond to challenges in healthier, more constructive ways. CBT operates on the principle that while individuals cannot always control their circumstances, they can control how they interpret and react to these situations. Core principles of CBT. Cognitive processes influence emotions and behavior. Thoughts and perceptions play a significant role in shaping emotions and actions. For example, interpreting a friend's brief text response as disinterest might lead to feelings of rejection and behaviors such as avoiding future communication. CBT helps individuals identify and challenge such cognitive distortions, leading to more balanced interpretations. Behavioral patterns reinforce psychological distress. Avoidance behaviors, procrastination, or repetitive compulsive actions can perpetuate distress. For instance, avoiding public speaking due to fear of judgment might temporarily reduce anxiety but reinforces long-term fears. CBT addresses these behaviors through targeted interventions. Active collaboration and problem solving. CBT is a collaborative process where therapists and clients work together to identify problems, set goals, and develop practical strategies. This joint effort fosters a sense of empowerment and agency in clients. Skill development for long-term change. CBT emphasizes teaching skills that individuals can apply independently, fostering resilience and equipping them to handle future challenges. This includes techniques like problem-solving, cognitive restructuring, and behavioral activation. Key components of CBT. Cognitive restructuring. Cognitive restructuring is a fundamental technique in cognitive behavioral therapy, CBT, that focuses on identifying and challenging cognitive distortions, irrational thought patterns that contribute to emotional distress. Common distortions include catastrophizing, expecting the worst possible outcome, such as, "If I fail this test, my life is over." Overgeneralization, drawing broad conclusions from a single event, like, "I've messed up this project, so I'll fail at everything." Black and white thinking, viewing situations in extremes with no middle ground, such as, "If I'm not perfect, I'm a failure." And personalization, blaming oneself for events beyond one's control, like, "It's my fault the team didn't succeed." Through guided exercises, clients learn to recognize these distortions, assess their validity, and replace them with more balanced and realistic thoughts. For instance, a person who thinks, "I always mess things up," might reframe this to, "I've made mistakes, but I've also succeeded in many areas," promoting a healthier, more accurate self-perception. Behavioral techniques. Behavioral interventions in cognitive behavioral therapy, CBT, aim to modify actions in order to break cycles of avoidance or unhelpful habits. Common techniques include behavioral activation, which encourages participation in activities that provide a sense of accomplishment or pleasure to combat depression. Exposure therapy, where clients gradually confront feared situations or stimuli to reduce anxiety, especially effective for phobias and PTSD. And activity scheduling, which involves structuring daily routines to include positive and meaningful activities, thereby improving mood and motivation. These interventions help individuals develop healthier behaviors, contributing to long-term emotional well-being. Thought records. Thought records are a valuable tool in cognitive behavioral therapy, CBT, designed to help clients track and analyze their automatic thoughts, emotions, and reactions in challenging situations. A typical thought record includes columns for the situation or trigger, the emotions felt and their intensity, the automatic thoughts linked to the situation, evidence supporting or contradicting these thoughts, alternative balance thoughts, and the emotional shift or outcome after reframing the thoughts. This practice promotes self-reflection and helps individuals gain deeper insight into their cognitive patterns, enabling them to recognize and challenge unhelpful thoughts and develop healthier, more balanced perspectives. Mindfulness and relaxation techniques. While CBT traditionally focuses on thought and behavior modification, modern approaches often incorporate mindfulness and relaxation strategies. These techniques help clients develop greater awareness of their thoughts and feelings without judgment, fostering emotional regulation and reducing stress. Effectiveness of CBT. Cognitive behavioral therapy, CBT, is a widely recognized and effective treatment for various mental health conditions, including anxiety, depression, PTSD, and OCD. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to emotional distress. By helping individuals challenge distorted thinking, CBT encourages healthier ways of perceiving situations, leading to improved emotional regulation. One of the key strengths of CBT is its structured and goal-oriented approach. It involves a collaborative process between therapist and client, where practical techniques, such as cognitive restructuring and behavioral activation, are used to address specific issues. Research consistently supports CBT's effectiveness, showing significant improvements in both short-term and long-term outcomes for many individuals. In addition to its applicability in treating mental health disorders, CBT can also be beneficial for individuals seeking personal growth. It can help manage stress, improve self-esteem, and enhance coping strategies for life's challenges. Its versatility makes it a valuable tool for addressing a wide range of psychological difficulties. Moreover, CBT can be conducted in individual, group, or online formats, making it accessible and adaptable to various needs. The skills learned in CBT often have lasting effects, empowering individuals to manage their mental health independently and effectively, even after therapy has ended. Advantages of CBT. Cognitive behavioral therapy, CBT, has gained popularity due to its numerous advantages, making it a go-to treatment for a variety of mental health conditions. One of its major strengths is its evidence-based nature, as extensive research consistently demonstrates its effectiveness in treating issues like anxiety, depression, and PTSD. Unlike therapies that can extend indefinitely, CBT is time-limited, typically structured around 8 to 20 sessions, which makes it both a focused and efficient option for clients. It is also skill-oriented, teaching clients practical tools and coping strategies they can apply independently, fostering long-term resilience and self-sufficiency in managing their mental health. Additionally, CBT is highly customizable and can be tailored to address individual needs, often being combined with other therapeutic approaches for a more comprehensive treatment plan. Another significant advantage is its accessibility. CBT is widely available and adaptable to various formats, including individual, group, or online therapy, making it easier for individuals to access regardless of location or preference. These factors contribute to CBT's broad appeal and its proven success in helping individuals improve their mental well-being in a structured, efficient, and accessible way. Limitations of CBT. While cognitive behavioral therapy, CBT, is highly effective, it does have limitations that may affect its suitability for some individuals. One key challenge is that CBT requires active participation and a willingness to engage in introspection, which may not be comfortable or appropriate for everyone or every condition. Its focus on addressing present thoughts and behaviors can also be a limitation for individuals dealing with deep-rooted issues tied to past trauma or experiences, as it may not fully explore these underlying causes. Additionally, CBT can be uncomfortable at the outset, especially when clients are required to confront negative thoughts or undergo exposure therapy, which can be emotionally challenging. Another limitation is that the benefits of CBT rely heavily on consistent practice and application of the skills learned in therapy, requiring individuals to make an ongoing effort outside of sessions to implement these strategies in daily life. For some, this level of commitment can be difficult, potentially limiting the long-term effectiveness of the treatment. Despite these challenges, CBT remains a powerful tool for many, but it may not be the best fit for everyone or every situation. The role of the therapist. The therapist's role in CBT is collaborative and facilitative rather than directive. They guide clients in identifying patterns, setting realistic goals, and practicing new skills. The therapeutic relationship is built on trust, mutual respect, and a shared commitment to achieving desired outcomes. Therapists often assign homework, such as completing thought records or practicing behavioral techniques, to reinforce learning between sessions. Modern adaptations and innovations. CBT has evolved over the decades, integrating elements from other therapeutic approaches and adapting to new challenges. Third-wave CBT therapies, such as acceptance and commitment therapy, ACT, and dialectical behavior therapy, DBT, incorporate mindfulness, acceptance, and emotional regulation strategies to address a broader range of issues. Digital CBT platforms and apps have also made therapy more accessible, offering interactive tools, guided exercises, and teletherapy options. Cognitive behavioral therapy is a powerful, evidence-based approach to mental health treatment that empowers individuals to understand and change the patterns of thinking and behavior contributing to their distress. Its structured, collaborative nature and focus on practical skills make it highly effective for a wide range of psychological conditions. By addressing the interplay between thoughts, feelings, and actions, CBT provides individuals with the tools to navigate life's challenges and foster long-term emotional resilience. Despite its limitations, CBT's adaptability and proven success ensure its continued prominence in the field of psychotherapy, offering hope and healing to countless individuals worldwide. We hope this video helps you, and check out our other video related to mental health.